Does birth control affect brown discharge?
Hello everyone, and welcome to today's video. In this video, we will be discussing the topic of whether birth control affects brown discharge. Many individuals who use birth control may notice changes in their menstrual cycle or vaginal discharge, and it's important to understand how birth control can potentially impact these factors. So, let's dive in and explore the relationship between birth control and brown discharge.
What is brown discharge?
To begin, let's understand what brown discharge actually is. Brown discharge is a type of vaginal discharge that appears brown or dark brown in color. It can vary in consistency and may be light or heavy. Brown discharge typically occurs when old blood is expelled from the uterus. It often appears towards the end of your menstrual cycle and is considered normal in certain instances.
Types of birth control and their effects.
Now, let's explore the different types of birth control and their potential effects on brown discharge. Oral contraceptives, birth control pills. One common form of birth control is oral contraceptives, commonly known as birth control pills. While birth control pills do not directly cause brown discharge, they can influence your menstrual cycle, which in turn can affect the timing and characteristics of your discharge. Some individuals may experience changes in their menstrual flow or have breakthrough bleeding while using birth control pills, which can result in brownish discharge. Hormonal intrauterine devices, IUDs. Hormonal intrauterine devices, IUDs, are another type of birth control method that can impact your menstrual cycle and vaginal discharge. IUDs release hormones into the body, which can alter the uterine lining and affect the consistency and color of your discharge. While it's not uncommon to experience changes in your menstrual cycle, including brown discharge, when using hormonal IUDs, it's important to consult with your healthcare provider if you have any concerns or persistent changes. Other forms of birth control. There are various other forms of birth control, such as contraceptive patches, vaginal rings, and injections, which also have the potential to influence your menstrual cycle and discharge. Any changes in hormone levels brought about by these methods may affect the color and consistency of your discharge, including the possibility of brown discharge.
When to seek medical advice.
It's important to note that while brown discharge is often harmless and a normal part of the menstrual cycle, there are instances when it may indicate an underlying issue. If you experience any of the following alongside brown discharge, it's recommended to seek medical advice: foul odor, severe pain or discomfort, excessive bleeding, itching or irritation. These symptoms could be indicative of an infection, hormonal imbalance, or other medical conditions. Consulting with your healthcare provider will help determine the cause and appropriate course of action. To summarize, birth control methods can potentially influence your menstrual cycle and the characteristics of your discharge, including the presence of brown discharge. While birth control itself does not directly cause brown discharge, the hormonal changes brought about by certain methods may contribute to these changes. It's essential to understand your body and monitor any unusual or persistent changes in your discharge. If you have concerns or experience additional symptoms, seeking medical advice is the best course of action. Remember, your healthcare provider is there to support you and provide personalized guidance based on your specific situation. Thank you for watching today's video. If you found this information helpful, please consider subscribing to our channel for more educational content. Take care and stay healthy.